Welcome back. Let's talk to Dr Charlie from Harley, a man who's got more letters after his name than in his name. Let's talk sport, Dr Charlie. How to deal with sport injuries. We saw this horrific broken leg at the Olympics, okay? What's typically the best situation? I see they put the poor guy on a stretcher and then they drop the stretcher.
Yeah, horror.
What if I witnessed that and there was no experts around, okay, what should I do?
Yeah, the problem with sports, I mean, I used to be a doctor for Fulham Football Club before. Did
you really?
Yeah, before Al Fayed took over. And one of the things we found was that the old-fashioned scoop, which is often used in these situations, like two elongated E's stuck together, is actually a very poorly designed stretcher for taking someone off, because the moment you're both holding it, you've got the patient in the middle, any sort of wobble can lead to virtually, you enter with a leg injury and leave with a head injury. So it's not the greatest thing. So certainly strapping in is really important, or having sides on the stretcher is important. I think the only way you can reduce those sort of complications is regular practice. So the team that are doing it maybe were new to doing it and hadn't had the experience of actually taking a stretcher with a weight and making sure that the individual was strapped in. Ideally, in a sports environment, you have people who are specially trained for sports-related injuries. If you break a leg, obviously that's damn painful, so you're going to need relatively early painkillers. You may lose quite a lot of fluid quite quickly, so you're going to need the fluid replacement. But I'd say the most important thing is painkillers and fluid replacement, and somebody who knows at least the core anatomy to make the diagnosis.
Understood. So part two, Sergio, the producer, said to me, did you know, Moose, that Alzheimer's is particularly prevalent for the World Cup, 1966 World Cup team? Yeah. And this was, they believe, down to the football being heavier and constant heading.
Yeah, it's a really good point. I think the thing about footballs in those days and the tendency to head, they probably led to several minor injuries, whether it be levels of concussion similar to what American footballers might suffer, certainly neck injuries as well, because neck arthritis, etc. The link with Alzheimer's, I'm not sure about the actual factual side to that, because Alzheimer's, or a condition similar to Alzheimer's, will affect 1 in 3 people over the age of 60 anyway. So there may be, so disaggregating the data in terms of their ages versus whether it was due to the football. Of course, poor old Bobby Moore died of bowel cancer, so he's out of that statistic, and others would have died of other things, so they're out of that statistic, and the remaining ones that have aged, there may be a coincidental factor rather than purely an attributable factor that's caused by the head injury.
Understood. Let's take a very quick break, and we'll be straight back. Thank you.